All right, hi everyone, welcome. We're so excited to have another Instagram Live. Our guest today, I'm going to let him introduce himself. Go ahead.
I'm Dr. Hamrah, and believe it or not, I actually used to work with Yalda,
The other way around.
and or we used to work together. I'm a facial cosmetic surgeon practicing in Tyson's Corner, Virginia. So for those of you who are not familiar with this area, it's the Greater Washington, D.C. area. We call it here the DMV. And so I specialize in surgeries of the face, and whether it's reconstructive or cosmetic of nature. And I've been practicing here since what, 2009, 10?
Yeah.
About 12 years.
So I was honored back in 2012. I was hired by Dr. Hamrah. His practice is Nova Surgical in Tyson's Corner. He hired me as an esthetician, so I had the honor to work with him for 9 years. He did train me in operating room. I became a surgical assistant, and I became more motivated. I always say to everyone, to all my patients, to my staff, that when you have an amazing mentor, you can just learn and learn from the best. So I became a nurse, and I worked with him in Dr. Hamrah in the operating room, and here we are. So I'm excited to have you here. Thank you.
And so I'm so proud to be here, honestly, because I remember your first year when you actually started working with me, other than doing esthetician stuff, where you came to the operating room. Was I hard on you?
He was, yeah. No, I think he made me the best person. I do say from the bottom of my heart, I'm so lucky to
But
have
honestly, you guys, one of the things why I'm so proud of, I know we're like exchanging like love and stuff like that here, but it's really true. So one of the things I really admire about anyone, and especially Yalda, is that, if you can take the beating of life, meaning falling on your face like 500 times and getting up 1,000 times, and come out on top. That's really where it's at. Nothing in this world is given or gifted. You have to go take it yourself, and you did it. And
Thank you.
look, I'm so proud to be here. So
You're so sweet. Thank you.
Kudos to you, and that's what a go-getter is. So
Thank
I'm really
you.
proud
Thank you so much. I'm honored. I always share my patient. I had the best mentor. They're like, you're very great at what you do. I'm like, well, I didn't. I went to Hamrah University, so that's why. So we're gonna go ahead and cover a few exciting things that you guys always ask me. Dr. Hamrah, he's a facial cosmetic surgeon. His specialty is just neck above, and that's really exciting. And I know a lot of my patients, they have asked me about lip implant, cheeks implant, or chin implant. And some of them, they can't even believe that such a thing even exists as far as even lip implant and what that is. Would you please tell us a little bit more about that?
Right. So everybody's familiar with breast implants. People are even familiar with butt implants. So it kind of like surprises me that people are not that familiar with facial implants. Pretty much you can put implants anywhere. Facial implants are actually one of the oldest things in cosmetic surgery. They're made out of silicone, just like breast implants, not the liquid ones. They're like solid. And you can use them for any sort of augmentation of the face. It simulates basically your facial bones, because it's placed under the muscle right over the facial bones. So you can even fix asymmetries. And that's, by the way, how it started first. Patients with asymmetries or had some sort of reconstructive procedure after like a tumor resection, or they were born with birth defects and with facial asymmetries, and then for cosmetic purposes. So for example, let's say you have flat cheekbones and you have the option of getting fillers. It's a temporary solution, or as a permanent solution, you get a cheek implant. And the beauty about all these implants are that you can place them from inside the mouth, so there's absolutely no incisions and therefore no scars outside of the mouth. So that's why I love them.
Yeah.
And I mean, you could see hundreds of people on the street or in the mall that may or may not have facial implants, and you would never know, especially if it's done naturally, if it's done correctly. So the art is really the correct choice of the shape and the size, which can be customized, and that's somewhat of an art So that's why not everybody necessarily is doing it. Mostly like surgeons that specialize in the face,
That's what
and that's why not many people maybe hear of it.
Alright, so I just want to mention our giveaway. It's going to be 1 syringe of Derm Ultra for lip filler, and everybody just be active and alive, and you'll be automatically entered into the giveaway.
All right, sounds
Can I enter too, or?
Of course.
I can enter?
Yeah, lip filler for sure. So one of our guests are asking that who would be the right candidate, whether they want to have lip implant or they can have an implant.
That's a great question. So anybody is a right candidate as long as they know what it is, what they're getting, and they see someone that is really not just trained in doing the procedure, but has a lot of experience, because certain things require a lot of experience to be able to judge from the size and shape and so forth. And I just look at my own learning curve, like 10 years ago when I thought I knew everything. Now looking back, I'm like, wow, I can't believe how much I learned just through practicing. And so it's pretty much a numbers game. Experience is nothing but a numbers game. The more you do of something, the more experience you have. So it's a combination of someone that needs that particular procedure and the combination of a practitioner that is skilled and experienced in doing that. So that was a long answer to a short question. But the short question is, anybody is, as long as you're a good candidate, and there's no cookie cutter, say you're a good candidate, you're a bad candidate.
And is this like breast implant that needs to be replaced every 10 years or?
Okay, so that's an interesting point. I'm glad you mentioned that. By the way, it's a myth that breast implants need to be replaced every 10 years, guys. It's something somewhat was generated by the companies that provide these implants. Mm-hmm. So it's not true.
True. That
Silicone implants, you really don't have to replace them. Now, saline implants, as long as the valve is not broken, you don't have to replace them. As long as they don't deflate, you can keep them. So that's a myth right there. I just busted it for everyone, for whoever is viewing. And so no, you don't have to replace them.
Wonderful. Dr. Hamrah, can you tell us a little bit about your treatment when it comes to acne and acne scars? I have mentioned to my patients that, especially when I started working with you, I did have a lot of acne. I did have a lot of pigmentation, acne scars. So what are your recommendations for acne and acne scars?
So first of all, you have to treat the acne, because if you treat the scar before you treat the acne, you'll get new scars. So number one, so that's what the biggest problem acne patients have. They don't know how to treat it, or the treatment is somewhat difficult and it requires a lot of discipline. So it's like you can give someone advice or give them certain products, or tell them this is what you got to do, this is your skincare routine, and then you're depending on them following through. And then once you do that, once you get the acne under control, then you can treat the acne scars. But there are recently now with, for example, the radiofrequency microneedling like Morpheus, where you can do both. You can control the acne and treat acne scars. So you can do kind of both at the same time. And then ultimately, there's various types of lasers, and depending on your skin type and the experience of your doctor, it's the results may vary, right? So I see a lot of patients say, oh, I already did laser, didn't do much. Is like saying, I went to a restaurant, I had food, it didn't taste good. It's like, okay, so what did you have? Which restaurant did you go to? Who was your chef? I mean, it's not like the same thing.
And it takes time, right?
It
totally takes some time. Like I remember when I was working with Dr. Hamrah, we did multiple
yeah, and that depends on the severity, right? So not every not just every type of acne scar, but not every skin responds the same way. So you know, there is no magic treatment, so it's a time limit thing where over time you get improvement step by step, because basically what all these treatments have in common is they generate collagen production. And imagine like your pillows that lost feathers, and you're slowly adding the feathers back to the pillow, so not just like with one sudden treatment.
I have a provider here. Actually, she's a business owner. She's very successful. She's like, my client is here and is asking what can we do about saggy gels. And I think your recommendation perhaps would be surgery.
Yes and no.
Yes and no.
It depends what's creating the jowl. All right, so basic anatomy for everyone, real quick, just so you understand. Our body, our face in particular, consists of bone. I'm going from deep to superficial. So bone, then there is muscle, then there is fat,
and it's skin.
and then there's a little bit more muscle, and then there is skin. And then the skin has different layers too. So all these layers, within each of these layers, it depends on what's the culprit creating the jowl.
Mm-hmm.
Another clue is the age of the patient. So after a certain age, by definition, it's the muscle that's sagging, or it could be the shape of the jaw. For example, if you have a small jaw, and so your soft tissue envelope is going to be too large for the small jaw, and then you have jowl even when you're in your 20s. And so a simple chin implant or injections to the chin or advancement of the jaw in severe cases will solve that problem, so you don't need a facelift. And as you get older, in your 30s and early 40s, it's a little bit skinned. So radiofrequency treatments like neck tight or face tight, which are basically non-surgical, can tighten the skin and get rid of the jowl. And after the age of 45, once you pass that 45, that's like the golden time. That's when it's mainly caused by the muscle, and the muscle has to be lifted in order to achieve that. And I don't mean just lifted with duct tape. I mean, you really have to go deep and reposition the muscle, and that would be a facelift.
All right, so
staying on the same topic of non-surgical skin tightening and Morpheus 8, can you both tell us your experiences with Morpheus 8, as we know that both of you guys have the same devices?
I mean, my patient been very pleased with it. We start having it since December. I mean, it's a beautiful treatment. It's a combination of two technology together, microneedling, radio frequency, and the goal is to cause some trauma to your skin, so your skin is forced to heal, and by healing, your skin is forced to build more collagen. So basically, we're trying to force your skin to go against aging. And I always tell my patient, I'm like, keep in mind, after 3 sessions, even when we're done with your 3 session, you have to maintain it, because we're not stopping the aging process. A lot of patients that like, I had 3 sessions, 2 years later, I don't see the results, but it's so important to maintain. That's the goal.
That's it's all a good point. So just to give you an analogy that really takes home what you just said, the aging process is a slow process. So countering that doesn't happen overnight. So when you lose collagen over time, you can only fill it over time. So our collagen production after our mid-20s starts reducing, right?
Mm-hmm.
So our body doesn't produce as much collagen anymore, so every day we lose some. What Morpheus 8 does, and that's just in the skin, guys, it adds collagen with every treatment. So depending on what collagen deficit you started off with, you may or may not need more treatment. So if you have a lot of collagen deficit, you're not going to see results after 1 treatment. Plus, let's say after 3 or 4 treatments, we got your skin nice and tight. Guess what? The time you're aging, the clock doesn't stop, right?
Absolutely.
It keeps ticking. So let's say I just completed my Morpheus treatments of 3 sessions, and I'm like, great, Yalda, it looks amazing. Thank you so much. Well, guess what? 4 months from now, I just lost collagen again, so I got to keep it up. It's like saying I went to get a haircut, and then I never have to get my hair cut again. No, my hair keeps growing. Okay, guys? So that's the one thing where people get confused. They think it's like...
I tell you, it's like your muscle, your push-ups.
Exactly.
The minute you stop your push-up, everything goes back to how
that's
they used to be.
That's actually a better analogy.
Yeah, so you can use that in the future.
That's a good one.
It's a patent, but you can have it.
That's okay, I love it.
Yeah, of course. So what other question? I'm sorry, I'm going through the list, but I'm missing some question.
We know that you guys both do PRP for hair. Can you guys tell us more about that and what it does?
So PRP is a plasma-rich, platelet-rich plasma. You come to the practice, we draw your blood, we numb the area, and it just works like a growth factor. I know it's been used for years and years, and now they use it in the cosmetic field for helping to stimulate the hair growth. I know that it can also be injected to your face to help to stimulate the collagen. I know they use it during the surgery for the joint growth as well. So my patients, they've been very pleased with the results. I know you guys also.
Yeah, I mean, guys, platelet-rich plasma is not a new thing, right?
It's been around for a while.
I remember I was an intern 20 years ago. We used it for wound healing for when we took skin grafts or for diabetic patients. So it's basically your growth factors that come from your platelets. So when you cut your finger, your platelets try to create a scab and release growth factors so your skin actually heals. So this, what we're essentially doing, we're extracting the growth factors and we're putting it where we want. So let's say you do a microneedling treatment. You want the skin to heal faster and better with more collagen, which we just talked about. It's like a turbo boost for the skin healing. So it regenerates and generates more collagen. You can do it for hair. What it does, it doesn't grow new hair follicles, so you would have to still have hair follicles present. But what it does, the growth factors that strengthen the hair follicles, so you grow thicker hair faster, and hence it gives it more density. So it's very simple. Any cell would love growth factors because our cells have a cycle of growth. And what growth factors do, they help that cycle of growth to be more consistent and to be faster and more persistent.
All right, sounds
So,
good.
Does that answer the question?
Absolutely. Dr. Hamrah, I know you do offer fat removal in your practice. So some of the followers, they were asking if you can tell us a little bit more about buccal fat removal. And is this something permanent? Is it going to come back? And
Yeah, it's interesting. I've been doing buccal fat removal for 20 years, and I don't know where somehow
10,
it
right?
became it's like a thing now. And so it's basically you can slim down someone's cheeks if you have chubby cheeks. You can slim it down. So it's not the fat that's under your skin, it's the fat that's deep down under and in between your jaw muscles, and that's why it's accessed actually from inside the mouth. Sometimes when I do a facelift, especially a deep plane facelift, I can access it from the cheek, but most of my patients are young that have buccal fat removal. As a matter of fact, in an old patient, you don't want to remove fat. So you can access it from inside the mouth, and it's basically the fat that gives you the little cheek roundness on your cheek. So when you remove it, it basically makes your cheekbones pop more. It's kind of like all the ladies know what I'm talking about. When you put your shadow on your cheek, you put it right under your cheekbone to give that illusion.
Contour, yeah.
So what the buccal fat removal does, it actually gives that illusion or that an anatomic shadow even without makeup, and also makes your face a more triangular shape as opposed to round face. So love it.
Awesome. How long is the recovery from buccal fat removal?
Recovery, it's always a difficult question to ask. It depends on what you want to do. So if you want to go to Orange Theory or some boot camp, I would say 5 days. If you want to go to work, you can go to work the next day. If you want to go to school, you can go to school the next day. So it depends on what type of things you do. So there's really no downtime.
So they can go back to work.
Yes.
Awesome.
Unless you're a yoga instructor.
Yeah, so no, that's a good news. I mean, the beauty of buccal fat removal is the incisions from the inside, and you perhaps you may have some inflammation, perhaps, but you can resume your daily activity.
All right. So speaking of fat removal, can you guys both tell us about Kybella versus chin lipossuctions?
It's like slow cooking versus fast cooking. It depends on how much time you have, on what access you have. With anything, with Kybella is just to give people ideas. Basically, an acid that you inject, and it dissolves the fat, but it does it over time very slowly. And because it's an acid, it causes a lot of swelling, and it's somewhat painful. I mean, for those of you who had it, know what I'm talking about, and you know, most people do it awake. It's extremely painful. So you have to look at your of the value of something. People think of liposuction as something painful because most people's association with liposuction is
Surgery.
is body liposuction, which causes a lot of soreness. But neck liposuction really does not. I mean, it might feel like you like a type of muscle soreness after a workout for maybe 3 days or so. But for those of you, and hopefully some of my patients are here can attest to that, that had liposuction of the chin and neck, it's really not painful. Not even the procedure is painful because you do local anesthesia first and then you suck the fat. And it really, literally, once you get the local anesthesia, it takes like 5-10 minutes at most. And it's instant, guys. And there's not much swelling. And there's really no downtime. I mean, you wear like a neck wrap for like 1 day, 24 hours, and that's it. There's no incisions. There's just a little hole. So it's all right, let me give you the analogy. It's like swimming from DC to Sydney, Australia versus flying from DC to Sydney, Australia.
No, it's a yeah. With Kybella, you know, I think patients.
If you have a plane, you take the plane. If you don't have a plane, you're gonna have to swim, unless you have a boat.
Both sounds good. So what is the next question, guys?
So the next question is going to be speaking about non-surgical rhinoplasties versus surgical rhinoplasties and what both can offer.
I think we got a master here when it comes to surgery.
Yeah. So yeah, thank you. But you know, it's a great question because I get that question. Trust me, a lot. With everything you do, anything I do, you always have to do with the final result in mind. So also you have to look at, okay, I want to get from point A to point B. So when you want to get to point B, point A really matters. For example, let's say you have a large hump and your tip is perfect, you just have a big hump. Well, non-surgical rhinoplasty, for all of you that don't know what it means, it's just injecting filler to the nose. So anytime you inject something, you're adding volume. So adding volume where it's needed is perfect, right?
Yeah.
Let's say you have a divot on the nose, and if you filled that, the nose would have perfect contour. Hey, great choice, great candidate for non-surgical rhinoplasty, which is essentially filler. So let's talk about filler to the nose. And let's say you have a large hump and everything else is great. Well, you have to reduce the hump to create a contour. Well, you can't do it non-surgically. You have to get rid of the hump somehow. So it depends on what you start off with and where you're going. So that's my kind of quick answer to that.
Can you tell us more about the open or closed rhinoplasty, and what are the difference between when it comes to results?
So same exactly with non-surgical and surgical rhinoplasty. Closed rhinoplasty is in certain cases where you don't have to do any structural, major structural changes or major tip plasties, where you can do, you just need to do simple maneuvers. And by the way, the only difference between open and closed is the little incision at the columella. The argument for closed is that to avoid a scar, but then again, if you do it right, you shouldn't get a scar. So to me, even though it's an argument, it's kind of like a side argument, because as a rhinoplasty surgeon, you should be able to make an incision and close it such that you can't really tell. And those surgeons in the audience that are pros, and I know Dr. Masoud Saman from Dallas, Texas is in our audience, so he can attest to that. Great surgeon, by the way, in the Dallas area, rhinoplasty surgeon. When I see his results, you can't tell where the incision was. So when you do things right, then it doesn't matter, because ultimately the reason why someone would choose a closed rhinoplasty is because they don't want to have a scar. But to answer your question, let's say you just want to remove a little hump, you can just go through inside the nose. You don't have to open the whole nose. You just shave the hump. You bring the bones together. You don't have to open the tip. If you do extensive tip work, you would have to open the nose up.
So for a patient who needs to do revision, are they going to end up having more scar tissue? Is this going to be more complication when it comes to rhinoplasty?
Yeah, well, you never want to do a revision. Unfortunately, it happens, right?
Of course, yeah.
it's always difficult when you do a revision. You don't deal with normal anatomy. The tissues don't separate as easily, so there's longer, more dissection, and you don't always know what the person prior to you did, the surgeon prior to you did. So it's almost kind of like opening up an Easter egg. But to give you an analogy, imagine to go through pages of a brand new book versus through pages of a book that got wet and then the pages dried up and they all got stuck together, and now you're trying to peel the paper from each other. It's so much harder, and there's always stuff that tears. I mean, it's just so much more difficult. A lot of times with revision rhinoplasties,
The scar tissue is
the scar tissue, but there's not enough structure there, so you have to reconstruct more, and to reconstruct you need cartilage. And a lot of times the cartilage is already taken from the first rhinoplasty.
So
then you have to go from the ear, you have to go to the rib. So it's a different ball game. It's a complete different ball game.
Yeah.
All right, so speaking about all these procedures, a patient just asked, how can someone heal faster and better with less bruising during these procedures?
I think that before care, I mean, as far as like, making sure you do take arnica, making sure like, 4 or 5 days before any surgical or non-surgical treatment, you stop consuming alcohol, caffeine, I don't know, vitamin, like some fish oil or spinach, anything that can thin your blood, aspirin, Advil. There's certain things that you can do to help your recovery, and of course, after your surgery or non-surgical treatment, there's things that you can do to increase, to help your recovery.
100%.
Yeah.
So nutrition is what she said essentially. Follow instructions, that's another thing. And rest, okay? And then eat properly and eat well also. Your body needs nutrition and you need sleep. So these are the main things. And then a lot of it is determined by your DNA.
Mm-hmm.
For example, if you're a redhead, you tend to swell or bruise more. So some of it, that's why you can't really compare patient to patient. But also surgical technique is important. I mean, I look at my patients today, they just swell and bruise less because I've refined my techniques.
Yeah, absolutely.
10, 15 years ago was different story. So technique also matters. That's why I always try to stay on top of my game and try to educate myself, see if there's any better ways, newer techniques where they're less invasive and less traumatic to the tissue, because ultimately the reason why we swell and bleed is due to trauma to the tissue.
Yeah,
so how can we minimize that with maximizing the results? So that's from my end, and then from the patient's end is what you said essentially.
Definitely. Anybody has any question? Would you tell us a little bit more about technique when it comes to neck lift, and what if anyone has to do a liposuction, do they have to have neck lift including that?
Yeah, well, that again depends on your age and whether you have muscle sagging. So a lot of times, let's say you're age 45, right at that border, right? So you might have a lot of fat, and so I go ahead and remove the fat,
Mm-hmm.
and I even tighten the skin using neck tight, radio frequency.
So is that does that consider with a lot of recovery, or
No,
the neck tie?
that's neck tight is no recovery. Like just one day because you have to wear that band, but that's it. So let's say you do a neck lipo and neck tight with like 1 day, 24 hours recovery. Really, I mean, unless you're a yoga instructor, then 3 days recovery.
There's so much restriction for yoga.
And then but then if you have muscle sagging, now the muscle sagging will show because now you got rid of the pillow that was covering it.
Now, how about the skin?
And then you might need neck lift, surgical neck lift to tighten the muscle. So, so it depends, and I try to kind of predict that somewhat by the patient's age and by my physical exam, and so.
All right, thank you. It seems like everybody loves you, and everybody loves your analogy, so it's been very helpful. Thank you so much.
Thank you, guys.
So it's a new trend, cat eyes and brow lifts. So can you tell us more about that? What are your thoughts about that?
Yeah, I know it's not a secret that everybody loves to have the brows lifted, and Bella Hadid, Megan Fox.
Someone just mentioned about that.
So one of the things I want to mention, guys, since I have this forum now, a lot of the things you see on Instagram or online, a lot of it is done with makeup and lighting. Makeup and lighting makes such a huge difference. Okay, so don't get fooled by that. Don't jump into a surgery because you saw a picture thinking that was done through surgery or thread lifts or whatever that is, whatever methods of lifting. Also, there's extreme, like this cat eye surgery that they do in some countries where they actually stretch the eyelids upward. It's extremely damaging to the eyelids to the point that some of these patients are unable to blink. Oh. You can't blink. So when you can't blink, you can't moisturize your eye, your cornea, and your cornea dies and you go blind, okay? It's very hard to fix. So just precaution, be careful.
Absolutely.
Don't get like
caught up in this
suckered
Instagram,
into some type of procedure. But if you need a brow lift, it's very simple to raise the tail of the brow. It's something that we've been doing for decades. It's nothing new. You just make a little incision in the temporal area in the hair and then create a tunnel and then just lift the muscle. And it's permanent, guys. It's nothing temporary. If you want something temporary, you could do a thread lift. I'm a surgeon, so I'm biased. I'm a fan of permanent things. But if you want something temporary, just for a photo shoot or you're going to a wedding or something, and you don't want to invest the time and money, do other stuff. But the actually fox eye or cat eye thing, be careful, guys.
Yeah, I usually say more no to my patient because I do PDO thread, and I always tell them like, hey, I keep it very honest. I'm like, your results going to last 4 to 6 months. If you really want to do this just for a special occasion, it's worth it. Fair enough. But if you really wanted to have a brow lift, if you have a heavy lid, the answer would be definitely going to seeing your surgeon. A lot of patients, especially with heavy eyelid, they want to they want to lift the brow. But in my humble opinion, is that you need to have a blepharoplasty. Nothing by lifting the brow can help with the extra skin. Is that right?
It depends on what's causing. It's what's causing
it. If it's due to extra skin.
So if you have brow droop, it could bunch up your skin underneath the brow, which is your eyelid. Mm-hmm. So some people think they need a blepharoplasty, which is eyelid skin removed, but in essence they need the brows lifted. And when you lift the brow, the eyelid skin looks perfect. Then you just need a brow lift. Most of the time, you need a combination of both.
Fair enough. And someone is asking, how much lift can you get from Botox?
How much lift? So a lift is a relative term, right? So lifting relative to what? It depends on what's causing it. So always remember, Botox doesn't give you a true lift. It's called a pseudo lift. A pseudo lift is a relative term, meaning relative to what you have right now. And I have to explain why that happens first, because the reason why we get this pseudo lift from Botox is because depending on how active your eye muscle is, which is a ring muscle that kind of pulls your brow down, depending on how active that muscle is, if you eliminate its action or weaken its action, then the brow goes into its natural position in the relaxed state. Mm-hmm. So that really depends on your anatomy. So if wherever your relaxed eyebrow state is, that's where it's going to go. But it doesn't actively pull the brow up.
Yeah.
It just relaxes it. So that's what kind of like, it takes a moment to wrap your head around it. It's easier if you see the anatomy of the eye muscle.
All right, Dr. Hamrah, there is one more question as far as different neuromodulators go. And what do you use at your office?
I used to use all of them just because I wanted to see what's the deal with the different types, until I realized that they're all pretty much the same. And you should be using the one that you have most experience with and most comfortable with, because ultimately we use the different products because of predictability. Like, I want to have a predictable result, the best possible result, and the same results every time I see a patient. I want to be able to know what's going to happen as opposed to guess what's going to happen. So if you use different products, there is no way. It's like driving a different car every day. Mm-hmm. We all know we're most comfortable driving our own car. And when we're driving our own car, the confidence we drive with and how we go into the curves, how we park it. It's just
You're
we just
comfortable
do it
with-
without
yeah,
actually
without
thinking. We might be shaving, eating a donut, and being on the phone, and we don't even know how we got from point A to point B. Versus you drive a new car, you have to look where everything is. So that's how I compare it to. So I personally in my office use Botox by Allergan, and I also use Jeuveau, which is I think came out like 3 years ago, because they work the same, you know. I always try to use promotions for our patients. We like to save our patients dollars, and so if we get a promotion, I use either Jeuveau or Botox, you know. And so
Yeah,
those
I
are
do
the ones.
agree 100%. You know, Botox been around for a long time. I think, you know, our patient gets such a great result, so why not to stick with something that you're comfortable with? I'm sure the other neuromodulators are great, but if you're comfortable with one
Yeah.
product, why to change around? So
Yeah, so guys, there's no good and bad. It's what you use more comfortable with. So don't go in your injector's office or doctor's office, insist, I want this filler, because every time I use the other one, it doesn't work. It is so much more to it. It's just, you know, it's not the actual pain. Is the artist that uses the pain.
that's true. So I think there's one treatment that you do offer that many people may not know, but it's very trendy these days, is dimpleplasty. So for patient who, I mean, you know, who doesn't want to have a dimple? It's a very cute thing that when you add to the facial expression. So would you tell
Yeah.
us more about the dimpleplasty?
Yeah, it's been a huge uptick now since the pandemic. People are on Instagram Live, they're on Zoom, they're on FaceTime a lot more than they used to. And also with social media, you know, you get to see more pictures, and, you know, if you see someone with dimples, you're like, oh, I like
That's
dimples.
so cute, yeah.
I think it is. And so dimpleplasty has been around for many years. I was, you know, one of the first or only ones in the DMV area that used to use it. I mean, I had patients referred to me by the doctor show from LA for dimpleplasty. And I'm like, how the hell do they know that I do dimpleplasty? But guess what? It was on my website, and someone just Googled it over there.
Yeah, it was.
And so that's when I realized that back then, we're talking about 15 years ago, it wasn't that common. But now it's very common. It's super easy to perform. Sometimes the dimple fades over time, but it could be easily recreated. It's very rare though. I did have several patients that it went away after a year or so, but I offered to do that again for them for no fee. But it's quick, it's effective, and it's very cute. And the recovery is a couple of days. Just soreness of the cheek. It's a muscle defect that people have
So is the
that
incision
have
from
dimples.
inside or
So the incision
outside?
is from inside the cheek, and you just cut a little bit of a piece of muscle and throw a suture to tag the skin, and boom, you have a dimple.
Yeah, guys. So it's cute. It's very cute. So for the ones that you guys want to know more, I will share Dr. Hamrah's page on my Instagram. So feel free to send him a DM.
Yep.
It's been fun. All right. So I guess we're gonna announce our giveaway, guys. This was exciting. So go ahead.
Alright everybody, so the giveaway winner for one syringe of Rejuvenation Ultra for lip filler is at Miss Bia G.
All right.
All right, congratulations.
Congratulations. Well, thank you, everyone. This was fun. Thank you so much for
You're
your
so
time.
welcome.
I
Thanks for
appreciate-
having me.
I appreciate that. Thank you.
My pleasure. Thank you,
Of
guys.
course. All right, guys. Thank you.
Thank you.
Thank you. Done? Save?